Hi, yes. Thank you so much for inviting me to the Teach to Reach session on preparing COVID-19, preparing for COVID vaccine introduction. My name is Ann Moen, and I'm one of the co-leads for the Country Readiness and Delivery workstream in the vaccines pillar, and we're working together with Gavi, UNICEF, and many other partners to develop tools and trainings that can be used to help countries prepare for introduction of COVID-19 vaccine.
Thank you. And I'm now going to ask the participants in the room. You can all see the chat. And now I need you to go to the polls. You see there's you click on where it says polls right next to the chat at the top right of your browser. And you'll see the first question is to select where you work. So please go ahead and select where you work. So you have lots of options. In that, those are the WHO regions. If you work at country level for WHO, UNICEF, country level for the ministry, and then or partner organization. So I believe most of the people in the room are likely to be, from the country level. But let's find out with the polls. So please go to the polls. And do you want to wait, Anne and Shoshana, until, or should we proceed?
As you wish, that would be great. We could get started while they're finishing the poll. If we can do both at the same time, that would be great. So maybe you go to the next slide then.
Right. All right. Yes.
And so just basically today, I think I want to cover in a snapshot a lot of the resources that you might find useful for getting your countries ready to introduce COVID-19 vaccine. But I want to start with talking about this first slide, which shows a chart of some of the historic vaccine introductions that have taken place over time. If you look at the first arrow, the blue arrow, that's where the initiation of support for the hepatitis B vaccine and it needed to be introduced. And you see that from about 2000 to about 2010, we had to roll vaccine out to about 80 countries. So we had about 10 years to do that. Then the next example is the IPV vaccine. When we had the switch and we started to roll out vaccine, we had to bring on almost 80 or 90 countries in just a 3-year span. And so that was quite a daunting task. But if you look all the way to the right in the red bar, you see the big challenge that faces the entire world with trying to introduce vaccines to into essentially the entire world's population. So within 1 to 2 years, we really need to try to reach all 194 member states and other territories and areas. So it's a huge task. Next slide, please. So we've developed a country readiness and delivery work stream at WHO, and it's part of the ACT Accelerator program. There's 3 pillars there: vaccines, therapeutics, and diagnostics, and it's all built on the health system strengthening sort of foundation. Today, we'll be talking about some of the work in the vaccines pillar, specifically around getting countries ready and the tools that we've developed. And the goal of our work group, the Country Readiness and Delivery Work Group, is really to develop and disseminate adaptable tools that are usable by countries globally, and then to support all countries in preparing for COVID-19 vaccine introduction. Let's go to the next slide. So the first thing I want to bring your attention to is our website. We're trying to make this a one-stop shop, and the URL is here, and I'm hoping that slides will be disseminated and available to everyone after this. But we're trying to make it and organize it so that you can find everything you need on this website, from how to prepare your national deployment plan, to how to look at access and demand, to safety trainings, to specific vaccine, if you're launching a Pfizer vaccine or a Moderna vaccine, specific vaccine-specific tools, and the whole host of tools that you'll need, costing tools, et cetera, as you plan to deploy your vaccine. And we also have on the slide the email for our country readiness and delivery resources. And this email is a blanket email you can use if you have a comment, if you have a question, if you have feedback, or if you need more information on a topic, you can send it here and we manage this in triage so that you have a one-stop shop for both how to make comments or feedback, ask a question, and also where to find the documents. Next slide, please. So one of the first things that you'll see on this webpage is the fact sheets. And so we've tried to come up with the top 10 answers that we're hearing most frequently from questions about preparing for COVID-19 vaccine introduction. And so you can go there to see if some of your top questions that come to mind are answered and see what other people are asking. And then again, if you wanted to, you could send us a question that you have into the CRD resources link to get further questions answered. Next slide, please. So we started out back in October with a vaccine introduction readiness assessment tool. And this tool is simply that. It's to really get countries started. It was helping them think through and develop a planning roadmap for what they needed to do to establish all the systems that needed to be in place to prepare for COVID-19 vaccine. It wasn't a planning tool per se. It wasn't a detailed strategic plan on getting the vaccine to the exact person, but more looking through the various things, setting up a coordination committee at your country level, starting to think how you would finance your vaccine rollout. What are the steps you need to take to prepare for regulatory, and so on. So it wasn't so much a detailed strategy tool, but a tool to really jumpstart a country's planning. So hopefully every country is beyond this phase, but if you're just getting started, don't worry, start here, take a look at this vaccine introduction readiness assessment tool and see which things are already close to up and running or developed in your country and where you might supplement that to prepare for getting ready. Next slide, please. So this is a companion tool basically to the VRAT that I just showed. It's the NDVP plan, the National Deployment and Vaccination Plan. This is really a guidance on how to develop your tool or your strategy for rolling vaccination out to all of your partners. So this tool really goes through all of those areas that the VRAT told you to start thinking about and helps you think through how do you consider your priority populations? How do you take into account the SAGE recommendations? How do you plan your budget? So this is a much more detailed guidance on putting your plan together. And an important thing about this document is at the back of the document, there's a template that will help you start to build your national deployment and vaccination plan so that you can start to outline it in a sort of systematic way. If you haven't already started, I would suggest using the template in this document for guidance. The other thing that's really good about this guidance is it links to more detailed guidance. So it will tell you, for instance, how to do the safety part of your plan, AEF, eye monitoring, etc. But then if you want more information, there's links in each section of this document that give you additional information, additional resources, and additional ways to think through your plan. These plans, once you develop them, will be uploaded to the partners platform that's housed at WHO. It's the COVID-19 partners platform. This is how every country will need to develop and submit their plan so that it can be assessed and reviewed to get into the allocation round, to have vaccines coming out through the COVAX facility. Next slide, please. And then once you've got your plan and started your plan, we're starting to put a lot of materials for training on our website and on the WHO, openwho.org website. So the one on the right here shows the orientation to national deployment plans for vaccine planning. And it basically walks through all the chapters in the document that I just showed. So it's much more detailed about how to think through development of your plan. And this can be viewed personally by yourself. Or you can also download the slides and you could do a training for your core group of learners or your core group of people that are developing your plan. So it goes through every chapter to tell you how to build your plan, and it links to additional resources. On the left, once you've got your plan, you really need to start getting, and even before your plan, you need to start getting your health workers trained and prepared. So we've also put on a whole suite of courses for vaccinating healthcare, for training healthcare workers on vaccination for COVID. And the important thing about this is you can start right now, even if you don't know which vaccine you're getting. This is really not specific to any one product. It's really talking about your program, how to target your populations, how to communicate with your patients, how to schedule, how to track safety, et cetera, et cetera. So this is a very good training for health workers, and all of the links are provided here. Let's go to the next slide, please. Another tool that we've developed and that's available on the website are simulation tools. So these are very good for specific parts of your plan and looking at subcomponents of your plan. One thing that we're asking or suggesting every country to do is get your national regulatory authority and groups that will be importing the vaccines and into the country to really run through some of these regulatory and safety components training. It'll really make sure that when the vaccine arrives in your country, you know exactly which procedures you need to take. Who do you need to get the import permit from? Who do you need to give it to? How do you need to get the vaccine fully licensed and ready for use in your country? So the dry run will really help you in this exercise. Make sure those things are in place so that when the vaccine actually arrives, you're not struggling to figure out what to do next. Similarly, there's an exercise that goes over vaccination strategies and communication, supply and logistics. So there's a lot of exercises online that will help you figure out how to conduct your own simulation exercise and some templates. And so that's the next resource available. Am I going okay? Or let me ask you, when is the next poll? Tell me if you want me to pause, okay?
All right. I'm doing fine, Shoshana. Should we share any of the next polls at this point? I think I can share. 25% here are from country level WHO, UNICEF, 34% from country level ministry, and then 31% from partner organizations. We didn't really get a breakdown. There's one person from WHO or UNICEF HQ, and then 5 votes from the African region. So that's the composition here. The next, for participants, the next stage of the poll, Shoshana, should I share that now?
Sure, yeah, I think we can share the next couple, and then we'll just save the last few for after the course so that folks can continue to learn about the different resources and input their answers towards the end.
Great. Yeah. So the next question here is, please select your area of expertise. So if you're looking at the chat, and I know everyone's looking at the messages in the chat, if you go at the top of the chat, you see chat and then you see polls. So it's not like Zoom where the poll pops up in front of your window. So you need to click on the polls and then you will see the series of questions that we're asking you to answer to help Shoshana and Anne from the World Health Organization better understand your needs. That's really what the poll is about and why it should be worth your time going through these questions as you listen to Anne. Back to you, Anne.
Oh, thanks so much. And you know what? It's already very helpful for me to know that over half of the people on the call are really from the country level, because I think your input and your feedback will be super important to us as you use the tools, as you use the Open WHO trainings, and as you have questions or comments or what really worked for you, please provide feedback. So let me continue in my journey through some of the tools that are prepared for country use. So there's a supply and logistics guide and assessment tool, and this provides key information for countries to prepare for their supply chain to receive, store, distribute, and manage their COVID-19 vaccines and ancillary products like needles, syringes, diluent, masks, PPE. So this is really important because this is a key part of your NDVP. When you're putting together your plan, you really do need to have a good overview of what can your cold chain system handle? How many vaccines could you receive at one time? And a really important thing is not to disrupt your routine immunization as well. So I know every country is trying to balance their vaccination programs, their cold chain, et cetera. So this supply and logistics guide can help do that. This is also connected into the health worker training. There's a module on supply and logistics, and likewise in the NDVP training, there's a module on supply and logistics. So just if you find that, if you want to have a simple module, so that's the good thing about the trainings on Open WHO. They're set up as a module style. So if you only have a little bit of time, you can go in and do one module at a time or a specific module that suits your needs. Let's go next slide. We all know infection prevention and control is super important, and that WHO has put out guidance on making sure that you you have a safe vaccination environment, and then how to apply your IPC, your infection prevention and control principles, as you're delivering your vaccines so that it's safe. So this is also linked on our website and very important in the planning stages for developing your strategy to vaccinate your populations, and understanding, how to set that up in a way that will really prevent the further spread of COVID and help you safely vaccinate your population. Again, the links at the bottom also show the various modules that go back to IPC in the trainings that are already posted on openwho.org. So the trainings are, so the guidance is on the website. You have it in a written form. You also have it as an Open WHO course, and in many cases, it's multiple facets. It's slides that you can do a self-training. It's slides that you can download to do a local training or a regional training, and it's also often short video clips. Next slide. So vaccine safety resources, we all know that monitoring for AEFI is really important for any vaccine program, but especially important for this vaccine program because these are brand new vaccines that we're rolling out in unprecedented speed. So there's a safety manual that helps countries to include COVID-19 in their overall plans for vaccine introduction and how to build on previous WHO guidance. And there's also a tool that helps for communicating about vaccine safety guidelines and provides tools for staff working in the field of immunization to support your effective communication around vaccine safety, making sure that your communication is unbiased and fact-based and harmonized with the state recommendations and everything else. Again, the links are provided here for specific modules in both the health worker training and in the NDVP for developing your plans, and the modules are highlighted here. Next slide. Monitoring guidance. I think every country needs to be thinking through, what are your indicators to show that you're doing a good job? How much vaccine you got? How many doses you've used? WHO is monitoring a lot of indicators on a global level. These have been shared out with the regions, and the regions I'm sure is sharing out with the countries. So we do have some core data that we're monitoring on a regional and global level, so that we can keep a pulse on how things are going and how to how to make sure we get the support if we see something that might not be going as well. But every country should also think through what needs do you have for monitoring objectives, and what are your key performance indicators? And so this guidance helps you really design the tools and systems to record and analyze your vaccination data. Let's go next slide. Acceptance and demand resources. We all know that rolling out a brand new vaccine is often quite a challenge, because you have a lot of communications that you need to handle carefully, and you need to manage misinformation and be clear about what we know and what we don't know. So there's a whole suite of products and training materials around acceptance and demand. So there's a behavioral consideration for acceptance and demand. There's also a guide to vaccine misinformation management field guide, which helps you think through the strategies to counter misinformation that might be local to your country. It might be to your region, and it might be just an isolated part of your country, but this will help you figure out how to get the messages right, how to manage misinformation. So there's a strategic approach webinar provides an evidence-based review of the impact on misinformation, and you can access that also on the website. The acceptance and demand resources are going to be available coming very soon. They're in final clearance at WHO, and these tools will also help you think through how to manage acceptance and demand, any vaccine hesitancy, and getting the communications right. Again, at the bottom, we've linked to the various modules in both the health worker training and in the NDVP planning that are related to acceptance and demand. So let's go next slide. SAGE resources. So I'm not sure if everybody knows, but I think everybody does know the landscape of the vaccines that are going through clinical trials and phase 1, phase 2, phase 3 is very, very complex. I think right now, and I could be wrong because it seems the number changes daily, I think there's 6 or 7 different vaccines that are licensed or close to license or in use in some countries. So the SAGE group, which is the Strategic Advisory Group of Experts on Immunization, is going to work through every single vaccine that receives EUL, PQ clearance or clearance from a stringent regulatory authority. They were walking through all of the data for each specific vaccine product, Pfizer and Moderna and AstraZeneca, on and on. So there's 2 kinds of information coming from SAGE. There's the generic guidance on the overall policy making and the background paper on COVID-19, who it's affecting, who are receiving the most burden, the elderly and some with underlying conditions. And it helps to supply the evidence you need for really prioritizing the use of vaccines in your context and in the context of limited supply. It uses the SAGE values framework for allocation prioritization of the COVID-19 vaccine, and it gives you some critical evidence for the questions you might need to consider around COVID-19 vaccine policymaking. So this is a snapshot of the generic, and if we go to the next slide, again, resources are linked here, I'll show you that we also have developed, first off, the mRNA Pfizer vaccine product-specific documents. So we understand that all of your prioritization, all of your training for health workers, et cetera, that needs to get started now, even if you don't know what vaccine you're getting. And that's why we have a lot of documents that are not specific to any particular vaccine, but to the training needs. And then to complement all of the products that are already posted, we're making the vaccine-specific products. These include not only the vaccine explainer, like you can see the picture of there, we also have a slide set that goes over everything that's specific to the Pfizer vaccine or the next vaccine that will come out. And it tells you how to do the diluent, how to store, what the different parameters and characteristics of each specific vaccine are. So there's the explainer, then there's a whole set of PowerPoints that cover just those things that are unique to that vaccine, and then the videos that also accompany the explainers and the slides that are product specific. And those will continue to roll out as the WHO SAGE continues to recommend and deliberate about additional products, and as the WHO PQ team continues to consider the emergency use authorization of additional products. So next slide, I think we're done. I think it's back to the feedback poll, and that was a really quick, I hope I didn't go too fast, walk through some of the tools that are available, but I think you get the message that the bottom line is our website is a one-stop shop. and you have that link, and you can go on there and browse to see which types of trainings suit your needs, depending on what your role is in the launch of COVID-19 vaccination. So let me stop there, and I'm going to go back to the slide so I can see the crowd.
Thank you so much, Anne Moen. Just to guide the participants, this is a new platform for everybody. This is not Zoom. So up here you have the chat, and right next to it you have the item that is where you will find the polls. So I see quite a few people have answered the first the first question. Let me see. So you just go through each item to select where you work. Many of you have already done that. Select your area of expertise. Have you enrolled in the Open WHO health worker or national deployment and vaccination planning for COVID-19 vaccine courses? So you, I know that many scholars certainly have, as we've communicated, Open WHO is an important resource. If you've completed the Open WHO, HW, or NDVP course, would you be interested in participating in the brief feedback interview or focus group? How is your country conducting or planning to conduct COVID-19 training? And then after this workshop, are you aware of the resources available and upcoming to support COVID-19 introduction? So that's probably save for last. But to go through the questions, I don't know, Shoshana, if there's anything you want to contextualize about that, about the poll too. And just from my side, so there's right now 143 people listening in. This conference has over 6,200 participants, registered immunization professionals. More than 80% of them are from the subnational level. Around a smaller percentage from the national level, and then you've got NGOs and of course the international organizations contributing to the conference. Shoshana?
Thank you so much. I think that was a fantastic overview. So I think that at this point, we're ready to go to the panelists so that they have that opportunity to provide some initial feedback. We're looking forward to hearing about their experiences with COVID-19 vaccine introduction planning, whether they've used some of these resources, and their thoughts. Ready? Do we want to pull back up that slide with the questions so it's easy for...
So I actually don't have in the slide deck. Okay, yes, here it is. All right, I'll bring that right back up. There you go. And it looks like
So wonderful. So our first question to our panelists is how they're conducting COVID-19 vaccine introduction planning, and whether they've used some of these resources and their thoughts. So we'll return over to the panelists. I see Dr. Tanushree is nodding, so over to you first.
Thank you, Shoshana. Thank you, Reda, and thank you, respected speaker Anne Moen. It was really a beautiful deliberation. To introduce myself before, I just want to say I'm Dr. Tanushree Mandal from West Bengal, India.
Sorry, Tanushree, could you speak up because we have trouble hearing you? I know this has happened before with your microphone, but I know also you can make it better. Or just talk really loud.
Thank you very much, Reda, as well as Shoshana and our esteemed speaker, Anne Moen. So it was really a very good deliberation and it was very interesting. So before I delve into these questions, I want to introduce myself. I'm Dr. Tanushree Mandal. I'm from West Bengal, India. And I'm the Assistant Director of Medical Education and an Associate Professor, and I'm involved in the effective vaccine management as well as cold chain over here. So regarding the first question, that is feedback on online courses, before I want to say that I'm happy to tell that in India has launched this COVID vaccine rollout from 16th of January 2021. And by now we have reached more than 2 million people who have been vaccinated. So I was really very motivated by this Virat BRAC 2.0 tool, which I had actually given some training to the healthcare workers, and I myself had written about an article on this very aspect in the policies for equitable access to health, which I shared in the chat over here. So, the courses and the resources are really wonderful. And I went through the Excel sheet of this tool, and it was really very helpful. And what I find is that it was one thing that was intriguing was that as you showed the tabletop simulation exercises. So can we do this online? Or is it has to be done in a offline online mode? So which is the best mode for this simulation exercises?
Sure, I can answer that question and connect you to some other folks, and then Anne Moen, if you'd like to compliment as well.
Sure, go ahead, Shoshana, go first.
So yes, the simulation exercise packages can be done virtually, and we are happy to connect folks who are interested in using the simulation exercises to the team at WHO that can help to facilitate that. So please send an email to CRD Resources. I'll put the email in the chat, and we can help to make that connection.
Thank you very much for that thing. And next, I was thinking about the vaccine-specific training material. So, does it contain the, how to tackle AEFI for that vaccine? Does it cover that portion also?
Yes, it does. It definitely covers safety, and it's a very important module. So I think you'll have these slides. Can you tell me, are the slides going to be distributed? Because we're happy they should be shared far and wide. You can click on those links. And in addition to the vaccine training, AEFI training in the module, there's also links to the whole safety manual. So you can get as much or as little information as you want, but the course covers the really main topics about AEFI, which is really important. So I would urge you to take a look at it.
And yes, just to clarify, yes, the slides are available to all participants. The link is in the participants guide, and we'll share it again and again, of course, for those of you who haven't gone fully through the participants guide.
Perfect. Thank you.
Regarding the second and the third question, that is how can we amplify the existing resources? I think this is a best method. Like this conference, Reach to Reach conference, is exactly the platform where it can be amplified, because so many participants from the different parts of the country and the world are coming close together, and they're listening to these sessions. So I think this is the ideal thing, and the more we are doing networking, we can spread this across. And third is, what else is needed from WHO to support the countries? I think WHO is doing a fabulous work, because the materials they are putting onto the website, as well as the videos and everything, so they are in one sense fabulous. Thank you very much for this, and I'm very honored to be a scholar of PGLF and to take a part into this. Thank you.
Thank you for your feedback.
Thank you.
Wonderful. Thank you so much, Tanushree. Let's turn to our next panelist. Amal, can you provide us some of your insight?
Yeah, sure. Thank you, Shoshana and Rida, for giving the chance. And thank you, Dr. Anne, for the interesting presentation. And I really enjoyed the presentation, because it reminds me 3-4 months ago what we have done. Basically, to introduce myself, I'm from Sudan. My name is Amal. I'm working with WHO as technical officer, and currently I'm based to support Pakistan in polio program. Before that, I was working in my country in Sudan as EPI officer for more than 5 years. So for coming to the presentation, I would like to interlink what I have learned now from the presentation. I supported now Saudi Arabia, because I'm also resident here. My family lives in Saudi. So whatever, the first thing I have started with, as WHO staff, I went through the website. Whatever the courses they launch there, and they are free. Related to the COVID, I have enrolled all the courses, and I secured the maximum certificates.
Yay.
So when they called me here in Saudi and they said, we need your support, I referred all my colleagues first to go through those courses because they are useful. And after that, as you discussed, Anne, about the countries, they have to modify their own modules. And we refer to WHO materials. And based on that, we look into, okay, the health system and what is currently going on in Saudi. We develop all the training materials based on the WHO material. The same as well, I was involved in the training, plus the cold chain equipment assessment exercise. It was for 3 months. It really helped us a lot. And what is now in my mind, because also I'm also thinking about my own people in Sudan. Definitely, we cannot compare all the countries together, but I would really suggest if WHO can, those countries like in US, in Europe, the countries already they have started and they introduced the vaccine. If WHO can gather all the information, what are the main challenging, what were the main successful stories coming out from those countries and share them with others. Like in most of African countries, I guess they will be introducing in coming months or after 2 months. So it will be really helpful. But I will encourage whoever is listening to us now really to go to the website, and there is nothing useful, there is nothing can stop you from going and learn whatever you have 1 or 2 hours. It will really help you. Thank you.
Wow, that's we could feature you in an advertisement for the product. So thank you so much for that really nice endorsement. I'm glad you found it really useful. It's a really nice feedback.
Wonderful. Thank you so much, Amel. As Anne said, it is so fantastic to hear about positive experiences and about how these resources are being further distributed and that folks are enjoying learning from them. That's amazing. I'll turn now to Eric for your insight on these resources and the COVID-19 vaccine introduction preparations.
Yeah, thank you so much, Susanna. And
I think,
Rita.
Eric, you're muted. I can unmute you.
Okay, can you hear me?
Yes.
Great. Thank you so much once again, Rita, for this opportunity, and Susanna. And I think most of my colleagues have really given much feedback on what needs to be said on the online or preparedness. And me, particularly in Ghana, let me say, we are hoping to receive the vaccine hopefully very soon. Though things are in play, but the online courses currently, like the Open WHO, I think I had an experience of that when I was in college, and from there, that was when one of my lecturers gave it to me, and seriously, upon signing up to that online course, I saw that, come on, there were a lot of stuff in there, and upon learning a lot from there, it has really helped me also gotten some different ideas that also helped me in the TGLF. And seriously speaking, I would say with the help of this online courses, for example, the how to communicate, effective communicate with the community on the COVID-19 vaccine introduction. And I say it has really helped because I was able to get this opportunity to get certain information from it. And that helped me train a whole cadre of professionals in my municipal. And you too, that we gain in communicating, it helped a lot because now that Ghana has opened tertiary institution, primary institution, people going to school, it means that we should get more information on how these people interact with each other. And getting these informations will help us contact, trace, and know other people. And with this communication strategy, it will help health workers when they visit the schools, they will be able to communicate very well so that they can at least start with their publicity in Ghana since the vaccine has not yet arrived. But with communication, it will really help this community and these high-risk people to really uptake with the vaccine introduction. Over to you, Susanna.
Wonderful. Thank you so much for that insight, Eric. It is great to hear about Ghana's experiences. I'll turn back over to Retta and Moen to indicate first how much time we have left in the session, and then I think based on that, either questions or final remarks.
Thanks, Shoshana. So just a point of order, at the 45-minute mark, some participants may have chosen to go to the networking. We had more than 4,600 individual one-to-one networking meetings yesterday. There's probably a similar number today, but I know I can see that the numbers of attendees here are not going down. So I'd like to suggest that if Anne and Shoshana, you're able to stay, that we continue the conversation in order to hear from more voices. There are definitely many comments, and so unfortunately we're missing our moderator. And then there are also a number of people who've asked to be to join the panel, which are two options. So we can either look at the questions. Unfortunately, I'm trying to figure out how to get the results from the poll. Let me see if I can. And then we can see with the time remaining if you'd like to think about what you would like to do now that we've heard from the three panelists. Let me see if I can bring up the poll in a way where we can share it with everyone. So let me see if, as I say, this platform is new for everyone, and this is where we realize like we all really like Zoom. Yes. So here is, I think. Now I'm going to be able to show the results. Right. So here I am in my screen sharing. I'm logged in as a participant. And I believe then in that case for participants, it is only once you have completed the poll that you can actually see the results. So this was a country one. So I'm going to have to answer. All right. 59%, of course, in immunization, 17% surveillance, 4% vaccine safety, 2% IPC, risk communications, 5%, program management, 7%, emergency preparedness and response, 2%, and then 6 others. So in terms of...
And Doretta, I've responded to the poll, so if you want me to pull those up or just to talk through them, I can do that too, if that saves you some time.
Sure, yeah, yes.
Okay, so it seems like we have almost 30% of folks who are on this call have already taken either the Open WHO Health Worker course or the NDBB course. There are others who did not know these courses exist, but of course now are familiar with them. And as you get those slides, you'll have those links. Please feel free to take those courses and distribute them widely to all the folks who need to have them. There is a lot of interest in being interviewed for folks who have already taken these courses, so that's great to see. And Retta, we would look to you for those results so that we can connect with people as appropriate and hear some feedback on their experiences. Regarding how countries are actually planning to do COVID-19 vaccine training, in the context of this pandemic, of course, it's much different than we would typically have done. Typically, we'd be doing a lot of face-to-face trainings. It looks like now that's only 15%. It's primarily actually a mix of online and face-to-face trainings called blended trainings. So folks are using a variety of different platforms to connect. What is great to hear is that after this workshop, 70% of folks nearly are familiar with the resources that are available to them. So that's great to hear that folks are now aware of these resources and know how to use them and where to access them. Almost 80% of folks said that yes, now they know where to go. And I hope that everyone is very aware of that country readiness and delivery webpage and that you'll have that link prominently featured throughout many of the slides that you saw today. So when you get the slides, you can easily go straight to that one-stop shop toolbox. And finally, last but not least, for whether or not folks feel like they would like to do onto their colleagues and networks, 92% of folks said absolutely, they would love to. Some other folks would like some additional information, and I hope that some of that information you can find as you go through the slides at your own leisure, or that you can write to that crgresources@who.int email. It's in the slides. It's also in the chat to find out some additional information. And with that, I'll turn it back over to Anne Moen.
So I'm happy to take any more questions. I can stay a few more minutes. I have another call at 6, but I really, I guess I want to thank everybody who called in today. I want to thank all the panelists. It was very helpful. It was actually a very nice surprise to find out that we had panelists that were going to be able to talk about the tools that we've been sharing and some of the experiences in your country so that we could understand some of the feedback. And I think going forward, it would be helpful to continue to get feedback, especially if there's needs that you see that we don't have training tools for, or something that we should consider as we're developing our plans to further support countries. So I just want to say thank you so much to the Geneva Learning Foundation for inviting us to this Teach to Reach session today. I have to agree with Dr. Tanushree, who said it was a really great way to sort of amplify messages out to further share information and resources. And so I'll just end by saying thank you so much for inviting us today.
Thank you, Anne Moen and Shoshana Golden from the headquarters of WHO for this great session. Thank you to the members of the organizing committee, Dr. Tanushree Mondal, Amel Altahir, and Eric Warmanorf, respectively, from India, Sudan, and Ghana. This is just a small taste of what we are doing as an ongoing exercise, building really these connections with immunization staff from all over the world, connections between them as peers, and connections also with the best available, most reliable global knowledge. I have to say, it's truly impressive how quickly WHO has been able to ramp up and scale up it's the level of information provided to countries, and that's really timely, of course, because we had to. Yes, and hopefully this kind of dialogue can also help inform on an ongoing basis, as opposed to an exceptional event, true double loop learning, where we learn from the field, and the field then also there's a two-way exchange and dialogue. So that's very much what we hope for, and I know members of the organizing committee very much have that conviction and have gotten to engage with folks from WHO, from Gavi, from other organizations, and have found out all parties involved have found those exchanges fruitful. So thanks to all involved, and I hope this is a beginning of a new kind of dialogue between countries, between people in countries and international organizations that serve them. Thank you so much.